Well, welcome back, everyone. We all know someone, a friend, a family member, a spouse who has lost their life to cancer. But when it comes to the war on cancer, statistics show fewer people are dying from the disease. According to the American Cancer Society, there has been a 23% drop in the cancer death rate since the peak in 1991. That drop translates into 1.7 million cancer deaths averted through 2012. The last year, data is available, and here to explain is a Dr. Chadha, an oncologist who practices at St. David's South. Good morning to you.
Good morning.
I was just telling you, it is hard to hear this for myself because personally I just lost a friend yesterday who had been battling cancer for about a year. But the statistics are saying that there is a bright spot in all of this. Is it certain types of cancer?
So we are seeing a drop in death rates through most of the common cancers that exist. So breast, lung, colon, prostate cancer, death rates have declined consistently over the last 20 years.
Mm-hmm. Is there a reason or a series of reasons?
So I think it's multifaceted in terms of why the death rates are declining. Part of it has to do with earlier detection of these malignancies. We obviously have better treatment that has evolved over the last 20 years. The rates of tobacco use in this country have declined steadily over the last 20 to 30 years, and that impacts the incidence of different cancers as well.
Mm-hmm. What about childhood cancers? Because I've heard over the last few months that there is not as much research out there when it comes to childhood cancers, and so the death rate is possibly higher among children.
Yeah, so, cancers tend to be more prevalent in elderly individuals. It's really a disease of aging. It can occur at any age. Research-wise, I think there is more research that goes on in adult malignancies compared to childhood malignancies. And so that could impact survival rates in that patient population.
Mm-hmm. We even heard about it in President Obama's final, State of the Union address. And I know the Vice President just coming out and talking about you've got to find a cure for cancer. Do you get hopeful when you hear these things? When they say that from the podium, what does it mean? More dollars, more effort? Are we getting closer to a cure?
So I think any positive momentum when it comes towards research and trying to identify new medications, new therapies that exist for different cancers is always important. This is a disease that's multifaceted, that has different causes. More research is necessary to really understand the biology behind all these different malignancies, and I think we're going to make incremental steps year after year, decade after decade in terms of achieving that goal.
Mm-hmm. What do you tell the person sitting at home, myself right now, who has experienced loss, seen friends, seen family members die from this disease, from someone who is I'm very lucky, I'm very healthy, and I'm thinking, how do I prevent myself from being in that place?
So the best sort of preventive tools that exist right now are don't use tobacco. Lifestyle changes and lifestyle modifications, I think, are very important. So obesity, I think, for the general public is under-recognized as a cause for different cancers. Prevention of obesity is important. Having an active, healthy lifestyle is also important, and there are nutritional factors at play as well. Finally, for most individuals, follow guidelines, talk to their physicians about what they should be doing in terms of mammography, cervical cancer screening, undergoing their colonoscopies when it's recommended, doing some of the health screening studies that are important for cancer or early detection of cancer.
Mm-hmm. We're almost out of time, but one quick question, because I've heard a lot about it, the genetic testing.
Right.
Would you suggest that? I know it's probably expensive.
So genetic testing, actually, when it comes to different cancers, specifically breast and ovarian cancer and even colon cancer, the price of testing has definitely decreased over the last 5 years. Each individual's risk is different and it's based on their personal and family history as well. So they should discuss that with their family care doctor or other physician, figure out what their risk is, and then depending on that risk and their family's risk, make a decision regarding whether genetic testing is appropriate.
All right, doctor, thank you very much. Great information this morning and good news overall.